Starting your time.
Yes, madam. Okay. Okay, madam. Shall I start?
Oh, 1 minute is there.
Okay, sure.
Ma'am, uh, this topic was given to me, ma'am. Dr. Sija here.
Task
It
Caesar
was
task
task
2 was.
one.
This
It
is
was
task
task one
1.
given to me. Yeah, yeah.
Yeah, task 2 has been given to you, Sija.
Oh, okay, ma'am.
Shall I start, ma'am?
Last 15 seconds. Start.
Okay. Hello, I'm Dr. Anusha, one of the doctors in the antenatal clinic today. May I please confirm your name and age?
I'm Martha, and I'm 34-year-old doctor. I'm really anxious to know is there something serious? Because I have been
Oh,
called very hurriedly.
yes, yes, Martha. I shall address all your concerns. Would you want me to discuss the reports first, or shall I ask you a few questions? Is that okay?
Yeah, yeah, you can ask.
Okay. Firstly, I apologize that my consultant is not available due to some emergency. So I shall continue with the consultation with your permission. Is that okay?
Hmm.
Mhm. Okay. So thank you, Martha. Can you tell me more about your concerns?
I just wanted to know what's wrong because they had called me very fast and they said I need to discuss the report. So
Mm-hmm.
I'm worried about my report.
Yeah, I get your point. I'll address all your concerns. And yeah, I can read from your letter that you had fever and this body ache a week ago and you were not feeling well. That's why you went to your GP to undergo these investigations. Is that right?
Oh, yes, 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 doctor.
Do you have any fever now?
No, no, I'm better off and I'm about to join my work also from tomorrow.
Mm-hmm. Okay, that's good. Was this associated with any rash?
No, no. There
Any
was just
noticeable?
just this fever and this malaise and all those things.
Okay. Any noticeable swellings on your neck or otherwise?
No.
Okay. Were your periods regular before?
Yes.
When was your last period, just to confirm?
Yeah, 10 weeks from my last period exactly.
Okay. Apart from this, did you have any other symptoms, say pain in your tummy, bleeding down below, or nausea, or anything like that?
No.
Are you taking your prenatal vitamins?
Yes.
Martha, have you been pregnant before?
Yeah, doctor, I'm having a Joe who is 2 year old and he delivered vaginally. He's a cute chap.
Okay, that's good. How is he doing?
He's fine.
Okay. Any problem in your pregnancy or delivery otherwise?
No.
Any medications that you are taking apart from this prenatal vitamins?
No.
Okay. Any medical illness for which you visit your GP?
Doctor.
Any surgeries on your tummy or down below?
No.
Any family history of concerns like clots in legs and lungs or any similar history?
No.
May I ask what you do for a living?
I am working in I go to the school actually.
Mm-hmm. Okay. So this must be like a primary school where you are surrounded by many kids. Is that right?
Yeah.
Mm-hmm. Is your partner fit and well?
Yes.
Okay. So can you tell me if you have any allergies?
No,
Mm-hmm. Any yellowish discoloration of the skin or anything like that you have observed?
no,
Okay. Do you know your BMI?
it's normal.
Okay, okay. Some personal questions, Martha. Martha, can I ask?
Yeah.
Do you smoke or drink alcohol?
No, I do not smoke, but occasionally in the parties, I do have alcohol shots sometimes.
Mm-hmm. Uh, Alcohol is not very good for your overall health and as well as in your
No,
pregnancy.
doctor,
So,
I'm just taking it as a occasional drinking. I'm not taking. I will avoid it in
okay.
pregnancy.
Sure, sure. Definitely. That's good. Are you into recreational drugs?
No,
Okay. Do you know your blood group?
A positive.
Any reservations if blood is required?
No,
Okay. Martha, have you felt low down, depressed in the last few weeks?
no.
Okay. Any other concerns that you wish to add?
I just wanted to know what is there in my report.
Sure, sure. I get it. So thank you for all the information that you have provided. I shall examine in presence of a chaperone with your permission. My nurse here will check the observations. And specifically, I will have a look at your tummy, any yellowish discoloration of the skin or any other noticeable swelling. Is that okay?
Okay.
Okay. Thank you for your cooperation. Um, so coming to your reports, Martha, I have confirmed the name, age, and NHS number on these reports, and they belong to you. Do you have any idea about the reports or has the GP informed you anything?
No.
Okay. So shall I tell my nurse to sit with you because I shall be offering you a lot of information today?
Okay. It's okay, doctor. You can just go ahead.
Martha, actually the report is not a very reassuring one. The report says it is cytomegalovirus positive.
My God.
It is a virus that can cause infection to the mother and can affect the baby. Are you
Okay.
with me?
Yeah.
Okay. So this usually can happen when the pregnant moms are around children, infected children, and usually in occupations like being a teacher or a nurse, they can contract this infection. Am I clear?
Okay.
Okay. So this viral infection usually causes fever and flu-like illness only in the mother, but somehow it can cause some risk to the baby as it can carry this infection through the afterbirths. So risks are actually more to the baby. That is when the mother is infected in the first 3 months of the pregnancy. Are you with me?
Yes, doctor.
So now the pregnancy comes under actually a high risk pregnancy. So your care will be taken by a team of doctors, including my consultant, a scan doctor, special imaging doctor, who is known as a fetal medicine consultant, baby doctor, myself, specialist midwife, and general practitioner. So we'll refer you to a fetal medicine specialist doctor also. And since this test shows it is positive, you will have to undergo a detailed scan of the baby at 18 weeks. Are you with me so far?
Okay.
This scan will be done to look for any abnormal changes in the baby associated with the infection, and you may be offered some needle tests. Do you want to know more about the test?
No, no, no. I just wanted to know. I have heard about needle test. I just wanted to know how then you are going to manage if.
Yes. So, if after the needle test, if it is positive, then the further management can be decided with regards to your priorities of the pregnancy. Women mostly with this type of infection, they have a choice to decide whether they wish to continue or terminate the pregnancy. That can be discussed once the needle test reports come. But if the report is negative, still you will be followed under a consultant led unit as uh, there is a chance that the baby can grow small. So you will be offered some 2 to 3 weeks regular intervals. You will be offered some scans to specific by the fetal medicine consultant, especially to look for the baby's brain. Am I clear so far?
Okay.
If the baby,
How my baby will be affected, doctor? If there will be this infection going to my baby, how my baby will be affected?
I understand. See, this usually in the when the baby is inside the womb, it can affect the baby's brain. It can affect the an organ inside inside the baby's tummy, like the liver, and it can affect the baby's eyes and the ears. Since the eye and ears can only be assessed after delivery, so shall I go on with the after delivery management now?
Yeah, you can tell me.
Okay, so the baby will be assessed by the baby doctor and also the specialist doctor to look for the baby's eyes, ears, and the baby's brain. So this is because this infection is likely to affect these organs. And then if all is normal, then the baby is still followed up at least till 2 years, depending upon the condition. Am I clear so far?
Okay.
The baby will also have to undergo special tests like CMV viral infection to be ruled out in the urine within 21 days of birth. Okay, so if there are any symptoms associated with the infection, the baby will be started on a special antiviral drug which is known as valcyclovir. That
Is
will
there any
also
drug which can prevent this transmission during this, which can prevent this infection going to my baby, doctor?
Yes, there are some research which is going on where it says that valcyclovir, which is an antiviral or a medicine that may be beneficial and can be given to the mother to reduce the risk of infection to the baby, which if the infection occurs in the first 3 months of the pregnancy. Okay,
Okay.
so apart from the ultrasound scans that you will be offered, a special scan like MRI brain will be done at 28 to 32 weeks to check for the baby's brain growth, which will be repeated after 3 to 4 weeks also. Are you with me?
Okay.
So, depending upon the condition of the baby, you will be informed accordingly. So, you will be under a regular follow up, and I think I have provided you a lot of information today. I shall provide you with the information leaflets. You can go through them. I'll definitely book a review appointment with my consultant so that you can come and discuss if there are any additional concerns. Is that okay?
Yeah. Okay, doctor. Thank
I
you.
shall. Okay, thank you. I also provide 24/7 contact number and also put you in touch with a counselor. Thank you for your time.
Bye, counselor.
Just so that if you are anxious about the report, you can have a word with him.
Okay. Anybody wants to comment on her performance? I will be open, giving open opportunity to everyone. Please come up. Please come up.
I'm just thinking if I missed a lot of it or just I. uh,
Anybody? Anybody? Manika ma'am. Hello. Manika ma'am.
Ma'am, overall, it was a good. She covered almost every point, ma'am. A few like maybe the features implications on the baby. She told coverly. Maybe the features in the ultrasound can be
Okay.
mentioned, and the fetal blood sampling, that part. And she also offered the choice of domination, and that is fine. And um, the valcyclovir in pregnancy that you prompted, but otherwise we could have told first only.
Hmm.
And
Yeah.
the mentioning that there could be a congenital CMV infection, and
Asymptomatic.
uh,
No. How will be the
yeah,
babies? Most of the babies, how
yeah,
it will be? They will be
they'll be asymptomatic. 10%
asymptomatic.
only
Yeah.
will be symptomatic,
Yeah.
and
So although it
even
will
after
be
birth
infected.
also, yeah,
Hmm.
only 1 in 8 will have features.
So those all
Dr.
points
Patul.
we could have been little more emphasized. Apart from that, too much irrelevant history and too much irrelevant
Yeah, that
options. Yeah, options you have given, Dr. Anusha. I feel that not to you have to take a very relevant history in such task. You can make it out that this is a task of CMV. Okay, so you just need to offer her CMV management. Counselor and all those things we do not need to offer. Jehovah Witness, do you think in CMV case she will be bleeding and she will be requiring blood and blood
Madam,
product?
I thought it is important for all antenatal cases.
No, it is not. You will fail in information gathering.
Okay.
You will fail in information gathering. It is wherever it is applicable that there is an anticipated blood loss, then only it is applicable. Otherwise, no.
Okay.
and the hygiene
I'll
measures, just to add, just
Yeah.
simple.
Yeah. Yeah, that's how the CMV getting treated. That only you need to tell her, and how you are going to manage her pregnancy. That is what you need to. So these are many relevant things were there. So do not just keep yourself targeted to the task. Do not go here and there, and do not ask too much of irrelevant thing. Okay. So your start was completed. So that's the reason you took 5 minutes of time, because this is a very small task where you could have completed within 3 minutes. If you want to see in detail what is she actually needed, how is your pregnancy, planned, unplanned, any concerns, okay, any nausea, vomiting, or any spotting during this pregnancy. Have you done your blood test? Yes, I'm due for that, and my scan also, I'm due for that. Okay, or my scan has been done and it was normal up to last week. Okay, menstrual history 12 weeks from my last period. Any medical concern, any surgical concern, any allergy, previous pregnancy, what, and social history. Do you smoke? Do you drink? Okay, that is only needed. Do not need to ask recreational drug in all the cases, thinking that every patient will not be a smoker. No, not be a druggist. Okay, every patient will not be a druggist. So do not ask those questions. Smoking and alcohol is okay. Allergy is okay. Blood group still okay if the patient is undergoing needle test. Apart from that, BMI still like okay, I will consider. But apart from that, no much history is needed here. Hmm? Absolutely low risk patient who has been who had a viral fever. You could have asked, how are you? How is your fever? All those questions should have been asked. Okay.
I
You
asked
asked, I
Madam
think,
for
yeah, you
fever,
asked
ma'am.
that question. How you asked me,
Yeah.
I told you that I'm about to join my period, join my classes. Okay, so those
Mm-hmm.
is only needed. No need of mental history, Jehovah Witness, and all those many history. There was many relevant question. Okay, the similarly examination is not needed when a patient had come to discuss the information in
Okay. The
reports.
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 Mm-hmm.
So no
Okay.
examination is needed here. So do not discuss the reports. Then, where it has been written name and NHS number, can you see the name and NHS number written over these reports?
No.
No? So, you can just tell that I am having your reports. You just say, here the patient is not going to ask you, doctor, do you think these are my reports? Yes, the reports of yours has been provided to me. There is no name, there is no NHS number, nothing has been given. It's just a piece of paper. So these are actually the things which you need to know. If it has been mentioned, then only you're going to say, okay, so your reports are with me. That's it. You say it very confidently that your reports are with me. That doesn't mean you
Mm.
need to say that these are your reports. Okay. You
Okay.
only explain that this your CMV infection is positive. What about other infections? And why it was tested? Okay. So that also you need to explain here. So we have tested, since you had a flu last week, the GP has sent some viral markers to see what kind of infection it was. The other infection like parvo, toxo, they are negative, but the most common infection what we are finding out in your case will be CMV. So here both IgM and IgG is also positive. So you have to explain the report. So the first is obtain focused history, explain the report, justify any investigation you will like to undertake, establish answers any questions patient have had, and discuss the care of plan. Okay. So all those things are very important. Then only you accordingly go ahead. Okay. It's not BB, and so why you every time you want someone to be sitting along with the patient, why you want to offer counseling in each and everything. Here only infection is there. We do not know whether the baby has been affected or not. So that's the reason you have to refer her to the fetal medicine expert. And from there onward, the fetal medicine experts will decide regarding the further testing. Okay, and that has to be referred after some stipulated time, 4 to 5 weeks, because now referring to them will not show us anything. Okay, now referring to them. Okay, and whenever you are offering ending the pregnancy, ask sensitively. Okay, or offer sensitively. Many women in this situation, they decide to end the pregnancy, something like that. Got it?
Okay.
Okay,
Madam,
so
I said at 18 weeks you will undergo scan. Yes, I should have mentioned first valcyclovir and then maybe the
yeah,
18 week
so
scan.
yeah. So introduction, situational awareness was there, GP late, not GP letter, GP investigations. Okay, anxious, absent consultant, worried about the report, might be some serious concern. Okay, so that is my concern. Aim agenda setting was normal. How is her period? How is her fever? Whether she has joined work? How is her pregnancy? Corresponding from last menstrual period, previous pregnancy, medical surgical allergy. Social history, occupation, smoking, alcohol, low risk history. Okay, so from her report only you can make it out that it's a low risk pregnancy. And then asking this with what do you know about your report? So did someone discuss the reports with you? No, doctor, I do not have a knowledge. So it's always better off. Okay, simple report, so normal first followed by abnormal, always remember that. And then what is this IgG meaning, what is this IgM meaning? So just tell her that IgG shows a past infection, however, IgM denotes a recent infection. So this means the infection what she is having is a non-primary. It is not a primary infection. If it is IgG positive, then it's a previously also she has been infected. Now also she has been infected. So it's a non-primary infection, which is acute infection. Okay, so which is acute infection or a reactivation of previous CMV infection or by a new infection. So something like that. This is the non-primary infection, but this is acute infection. Uh, what is CMV infection? You have to tell something about CMV infection, dear. You have. Oh, so okay, so something very hi-fi has been happened to me, and I don't know what is going to happen to me with this infection. Did you explain anything about CMV infection on my health? What are the implications on my health?
I said I think mother might have only flu-like illnesses. Nothing, nothing that would majorly affect the mother. I mentioned this
Okay.
point that the
Yeah.
flu-like illness. Yeah.
Okay, then that is okay because I must have missed it. So it is one of the very common community viral infection. Nothing to worry. Means it gets transmitted from person to person contact or nosocomial contact. Okay, community infection gets transmitted with the help of through this contact with this infected person. Most of the time, aerosols and all those things. Nothing to worry when it comes to the out of the pregnancy, but during pregnancy we need to worry because if the baby is getting exposed, there is a chances of congenital CMV, especially if it's a new infection, first infection. Okay, primary infection. In her case, it's person means she has been already infected. This is a repeat infection, which is acute infection. So but still there is a chances of congenital CMV infection. So what is congenital CMV infection to the baby, that also you have to explain her. So what the guideline or what the SIP says, the many babies are asymptomatic. It is not that each and every baby who is getting, whose mother is getting infected with a CMV will be having that congenital CMV infection. So you have to tell her this way that the many babies are asymptomatic at birth. Okay, so yes, mother's infection, then the baby's chances of baby getting infected is there, that needs to be identified with the help of some test which we will be doing. If the baby is not infected, the pregnancy will be considered as low risk, and we will be just observing the baby with serial growth scan to see how the baby is growing. Okay, if baby is being affected, most of the babies who are affected, they are asymptomatic at birth, but after few days, okay, after few days, they will be showing some concerns with the hearing loss or impairment with the vision. So this is the common presentation which will lead to learning difficulties, epilepsy in long run. Sometimes the infection will be very severe and the baby's in tummy will be affected, where the baby's liver, spleen, uh, platelet counts. Okay, so the blood platelet counts will also getting affected, and those will be a very those babies will be having a very poor prognosis. But apart from that, most of the baby will be having a asymptomatic presentation where we will be following this baby to see the future. Okay, so future course of treatment or the management will be taken care by neonatologist. So what next? If no infection, so you have to say that if the baby is not getting infected, then we will be reassuring you. So how we are going to affect the infection affect? So that avidity test, have you heard about avidity test about CMV?
Yes, madam.
Yeah, so what is avidity test?
If it is a low avidity means it's a recent infection, and
Yes.
high avidity means the past infection.
Yeah.
So if IgM, IgG both are positive, just to confirm whether it's a recent or not, we do an avidity test.
Yeah, so that also you have to mention. So we will be
Okay.
confirming by doing a avidity test, and once this avidity test will be done, simultaneously we will be referring you to the fetal medicine experts where you will be doing ultrasonography and needle test, which will be done on an average 4 to 5 weeks after the primary infection. So yes, 18 weeks, at around 18 weeks, we will be having a detailed anomaly scan, and depending upon that, he might be offering you a needle test to see the infection. Okay. Uh, Depending upon the infection, okay, if the infection is confirmed, and then yes, we do have options of many women do have an option of continuing a pregnancy and taking a risk, or means or few, we cannot say that many, few women decides to end the pregnancy because they do not want to take any chance or any risk. So the options we will be discussed once those options will be available. Now, following primary CMV infection in the first 12 weeks of the, if the woman is, just wait. So, following taking the antiviral medication, that is valcyclovir, it reduces the risk of baby become infected in coordination with virologist, physician, and pharmacologist. So if it is early pregnancy, then offering this medication valacyclovir is having a very good results. But here we have to discuss this with the virologist, physician, pharmacologist. Regarding unlicensing, most of the time I don't think this is a licensed drug, but we need to check. That's the reason I have not commented here. Okay, I have not included in the answer key. Where CMV infection of the fetus in the womb has been confirmed by amniocentesis. Okay, once the baby's infection has been confirmed, okay, a serial ultrasonography will be done to see the baby's growth and basically microcephaly. That means the head circumference of the baby will be seen. Okay.
Yes, ma'am.
Even if it is, even if the baby is not been infected, still we are going to go ahead with the growth scan. Hmm?
Okay, ma'am.
In infected fetuses as well as ultrasound scans, and if the baby is been infected, then there are certain tests to see the baby's organ like head, liver, and spleen. Okay, MRI scan also can be offered to this patient at around 28 to 32 weeks of gestation.
Hmm.
Okay, especially fetal brain. Okay, fetal
Yes,
brain.
yes.
Huh? In newborns with symptomatic CMV infection at birth, treatment with antiviral medications can be offered, which can also reduces the risk of hearing loss in most of the babies. And it can also improve the long-term brain development and outcomes. There is no licensed vaccine for CMV. Okay, so this is where with this we can just offer her close the loop. Okay, I have forgotten to write. So here we can just discuss close the loop. So that means we are going to offer her PIL of CMV. We are going to fix an appointment with the consultant, documenting her care in the GP letter or in her case details, so that the primary physician or primary caregiver will come to know what is exactly happening with the patient, and arrange a fetal medicine expert appointment within next 4 to 5 weeks. Okay, till that time she can follow up if she is having any concern. Okay, that's it. A simple task, do not try to make it very problematic. Support group is, if at all the baby is getting infected, then that CMV action is support group. Okay.
Okay. Actually, I was trying to mention the valcyclovir at 12 weeks while a point after the fetal scans.
Yeah,
But
yeah, you can mention anytime. That is okay. That is okay. I'm
yeah,
not taking it, even if I have prompted that answer has come up from you. But that irrelevant information gathering will be a bigger problem. And then going systematically. So go
yes.
systematically. Okay, so don't be haphazard. So history
Okay,
of
thank you.
symptoms, infection, chronology of symptoms, review investigation, concerns about the infection, past obstetric history. So this much is in only information gathering in this task. Nothing is there. Okay. CMV action is a support group. Okay. Communication, introduce, discuss, explain the results of the investigation. You have not discussed that. Explain the need to do the further tests, such as ability test, what it means, need to follow up with the ultrasound scan 5 weeks after the primary infection in FMU. Okay. Colleague. So, colleague here will be your consultant, virology department, fetal medicine expert, neonatologist. You have to involve the neonatologist also at some point of time. Um, then
Yes,
nurse
baby
specialist,
doctor I mentioned.
yeah, nurse
Okay.
specialist, GP, virologist, and physician.
Okay, ma'am. Understood. Yeah. Thank you so much.
Patient safety, ensure patient identify is confirmed at the start. This is with proposed cons and any invasive testing. So you need to just weigh cons and positive. So here I was not very keen on knowing that needle test. I just wanted to know what
Hmm.
are your options and what you are going to offer. How you are going to monitor these babies. Okay, so that is what actually needed in this task. That is patient safety. The knowledge part, yes, I do not say that the knowledge part is not there. You do have a very good knowledge part. The only thing is presentation of your knowledge is very important. How you are going to present that. So knowledge is basically referring to the fetal medicine expert, starting her on valcyclovir, explaining the implication of this infection on the fetuses, and monitoring how you are going to monitor the baby. Okay.
Okay. Madam, the SIP also mentions that the sample of urine or saliva of the baby, a newborn baby, has to be taken within 21 days to check and
No, that
confirm
is
for the
okay.
same.
That is okay. That is not, we do
Okay.
not need to go too much into the detail. See, this is not part two exam. Part three. You have to stick to your part.
Okay.
Okay.
Yeah.
Nobody will ask you what the pediatrician is going to do with all these things. It is their work. They will do what they wanted to do. Here, your work will be, yes, they will be screening. What you can tell them, they will be screened early in their life for this hearing and visual. That screening will be done very early.
Okay.
Okay, max to max you can say, but on what day, what on all they are going to offer, you can skip it out.
Okay, ma'am. So when the role player was asking if how this will affect my baby, so I thought that it will. She's asking me after the delivery how it will affect. So I started saying that.
No, 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 no. How? So here you can say that, yeah. So in if it, and even the CMV viral primary infection have the highest chance of infection to the baby. If it is non-primary, less likely, because the maternal antibodies are already there. So less likely the baby will be that severely affected, that severely. So here you can tell her that yes, there is a chance that this infection might have crossed the placenta and reached the baby. And if the baby has been infected, then in that case how will be your management and what will be the baby's affection. So milder cases it will be infected, but most of the time they will be asymptomatic. They might present later in life with some congenital deafness. Milder cases, moderate cases, little bit of congenital deafness, blindness, and the more severely affected will be microcephaly, hepatosplenomegaly, and thrombocytopenia. So these are the more
Okay.
severely affected babies.
Okay. Understood, ma'am. Thank you.
Now, I have one question.
Hmm? Yes,
In case of
Pavitra.
herpes simplex, we say that once the antibiotic is produced, it give protection. But here, if you have previous infection, it will protect or not? How
Yeah, it will
we have to
protect.
say that?
Yeah, most of the time it can protect. So that's the reason the primary infection is having the more severe case. So rather than commenting on that, you can just tell her that most of the time the infection will be self-limiting and it will not affect baby that badly if it is a non-primary infection. Okay, it will not affect
Okay.
baby that badly. If it's a primary infection during first trimester, then there is a very high possibility that the baby will be affected very badly.
Okay, and as they are now, it is non-primary infection, so
Yeah,
baby will
so
not that
baby,
much
baby
affected.
that not badly affected, not
Badly
badly
affected.
affected. Yeah. So, but
Okay.
we do have a time to decide how will be the baby's affection. Okay, so how? So reassurance should be the first thing, and few ideas about if at all the babies will not be that means they will not be that normal. Okay, so then what will be your option? So yes, termination should be given as an option, but then it should not be very means freely given. Okay, so if at all the baby has been affected very bad affected, then yeah, people do choose to, or women do choose to end the pregnancy. It's something like that. Any question? Shall I stop the recording here and we should go on to the next one?
Yes, ma'am.
So my take home message